So what's the deal with root canal treatments? It's like everyone has an opinion, and it's a very polarized topic. Some people say it's a necessary evil, and others say it's a dangerous procedure that can lead to serious health issues, and even it can kill you. So in this video, let me talk a little bit about the good, the bad, and the ugly of root canal treatments. Now, why do we even do root canals in the first place? Well, if there's a cavity in a tooth, and if the cavity reaches the pulp of the tooth, which is in the center of every tooth, and the pulp contains the nerve, and if the bacteria that from that cavity, they are killing the nerve, it can cause tremendous pain. And at this point, there are only two options for the tooth. One is to remove the tooth altogether, which is an extraction, or the other one is to save the tooth, and that has to be done in form of a root canal. That's it. Those are the only two options available. At this point, to just put a filling into the tooth will not solve the problem of the dying nerve. And also, we can't just leave the tooth untreated, because it will lead to serious infection and abscesses. So something needs to be done. And we have to make a decision: root canal or extraction. So what happens during a root canal treatment? Well, the dentist removes the infected nerve or pulp tissue. And then the empty space inside the tooth gets cleaned with instruments and irrigation. And once it's all cleaned out, this space gets filled with the filling material. So in the end, you're left with a dead tooth. Now, if the treatment is successful and everything works out, the pain is gone and you can keep the tooth. How do we know that a root canal is successful and the treatment is good? Well, then there's no pain anymore, and the tooth is functioning properly. And on the X-ray, we don't see any signs of infection anymore. Instead, we see the bone is repairing and the healing around the tooth. So therefore, X-rays are indispensable to determine the outcome, which is why root canal filled teeth, they need X-ray monitoring. That's the only way to see if the infection is healing and the bone is actually healing around the tooth. Now, here's the bad news. Root canals, they can go wrong. And in many cases, the tooth has to be removed even after root canal treatment. And that is very disappointing, because it has to be removed sometimes because of problems developing afterwards with the tooth. Sometimes root canal treatment does not resolve the original infection. That means the problem might linger on or even get worse. Or if the tooth is not sealed off properly after tooth root canal, the infection can creep in through a leaky filling from the top again. Another problem is that after root canal, the tooth is hollowed out and structurally weak. And a weak tooth can fracture when we put pressure on it. That's why it's so important to put a crown on a tooth that had a root canal, because the crown reinforces the remaining structure so that the tooth doesn't crack. Now let's zoom out for a little bit and look at root canals more from a holistic standpoint. Because the tooth after a root canal is a dead tooth, and it's disconnected from its nerve supply, from its blood supply, from its lymph supply, and what's left might be functioning very well, but basically it's a dead body in your head without any vital supply anymore. The tooth is now defenseless. Its own immune system is gone. Next thing is that in a root canal treatment, we will never be able to kill all the bacteria. So the tooth will never be sterile, and there will always be bacteria left. It's because of the complicated anatomy of the root canal within the tooth. And the dental instruments, they cannot reach to all the fine canals within the root, and they can't be cleaned out 100%. That's a fact that is not even disputed by any dentists or root canal specialists or any experts. Most dentists say that the immune system is very much capable of keeping the remaining bacteria at bay. And for as long as we see the infection is gone on the x-ray and the patient doesn't perceive any problems and the tooth doesn't hurt and it's functioning, everything is good. However, the remaining bacteria can have a devastating effect on our overall health. But the bacteria, they produce endotoxins that are far more devastating than the bacteria itself. So you see, it's complicated. On one hand, you don't want to lose a very important tooth. On the other hand, you don't want to put your health at risk when leaving a root canal treated tooth in your mouth. So the opinions are very, very polarized. Now, there are those who say all root canals are fundamentally wrong and they need to be avoided at all costs, and even existing teeth with root canal treatment, they all should be removed because of health issues. No matter if they are causing problems or not, they need to go, those teeth. The reasoning is based on that the dead tooth acts like a focal infection, spreading bacteria and toxins all over the body. They invade the surrounding tissue, get into the bloodstream, and settle at distant organs. And this line of thinking is supported by a famous researcher. 100 years ago, Dr. Weston A. Price performed experiments to prove that dead teeth are detrimental to your health. What he did was he implanted root canal treated teeth under the skin of rabbits. And what happened is that those rabbits, they got very, very sick and they died. So his research led him to believe that root canals are detrimental to health, should be avoided. And many researchers and health professionals have picked up on his research, and they totally agreed with his opinion. However, critics of this radical anti-root canal approach say that modern techniques of performing root canal treatments are far superior to the outdated techniques of the past. And today dentists generate much better results than 100 years ago. Today we use microscopes and very sophisticated techniques that reach even into the tricky parts of the root canal system of the tooth and clean them out much better. And we achieve much better results than the teeth that Dr. Price used in his research 100 years ago. So again, both sides of the argument have compelling reasons, and every tooth needs to be evaluated individually. We also have to take into account that some teeth are strategically very important to keep, and they are also very difficult to replace once they are gone. So it's a real dilemma. And a missing tooth can have serious consequences as well, functionally, aesthetically, and psychologically. And if we remove the tooth, we have to ask the question, what do we do with the resulting gap? The best way to replace the missing tooth is a dental implant. But if we are in line with this form of holistic thinking, we also should be critical about implants. Because from a holistic point of view, implants also present with issues. And it's important to discuss all the options and consequences before embarking on a decision. So there you have it. That's my take on root canals. If you like this sort of content, please like and subscribe to this channel. I also offer video consultations for clients who want to discuss their personal dental situation, like for example, root canal treatment that might be coming up. So please visit me on dentaldecoded.com. You will also find interviews and more in-depth analysis on all things dental from a more holistic point of view. Thank you for watching.